with all due respect.
Hey, we're Josh Ortegon and Greg Gaines, and this is With All Due Respect, the show where we keep it real about health, fitness, and performance. From weight loss to sports development, we're covering the conversations that matter.
Follow us on Instagram at Phenom Fitness, PHNM Fitness, and visit www.phenomfit.com to check out our training programs, coaching, and gear built for real results. Let's get into it.
All right. I tell you, Riverside doesn't tell me when we're live. And I'm so used to Zoom that when it goes, it's like, it just goes. I'm like, wait, is this an awkward moment? Like, because Zoom would be like, you're now recording. I'm like, yay. Now I'm like, we're good.
What's happening?
Hey, welcome to With All Due Respect, right? With all due respect. And we're in the 90s of our episodes. And Nikki, I want you to go ahead and introduce yourself. All right. Mostly because I'm going to screw up your last name. I know you told it to me, but like, I'm going to throw it on you. And the subject today, I think a lot of people are going to privately relate to it. And if you just kind of introduce yourself, where you are, what you do, and then we'll just start talking.
Yeah. Thank you guys for having me on.
Absolutely.
My name is Nikki Parlitsis. I'm a functional registered dietitian and certified personal trainer. I work virtually at Michelle Shapiro's practice. It's called Michelle Shapiro Nutrition. We see clients all over the country. The practice sees a variety of clients with chronic symptoms ranging from MCAS, histamine intolerance, POTS, hypermobility, digestive issues. I also see a lot of clients with eating disorders, particularly bulimia and binge eating disorder, because I experienced those myself throughout my life, and it took a long time to heal. So my favorite thing is reducing the shame stigma. There's so much shame and guilt and secrecy around it, and kind of bringing that to light, because the secrecy can also perpetuate the symptoms. So, that's one of my favorite things to talk about.
No, I love that. I said, nothing, shame around food is brutal, right? And we hear that from, you'll hear that in different environments from, oh, my husband wants me to lose weight, so I'm almost shamed for eating. Parents with kids, I've seen it with parents with kids. My kid needs to lose weight, and all of a sudden the kids, they're finding Kit Kat wrappers in the kid's closet. And I say that because I experienced that with a kid, where the parents kept coming up to me and they're like, hey, we're finding like food and Kit Kat wrappers in my kid's closet, and like we want him to eat healthy, but what's going on? And I'm like, oh, that's outside. That's outside of me. I was just a trainer at the time, right? And you also mentioned in going back and forth, POTS. And POTS is something I never really heard of. And I was like, when you hear those things of diagnosis, you're like, oh, she's got POTS. And you're like, well, is that they don't know what she has? Is that, it sounds kind of like is that a thing? But you don't want to gaslight people and be like, oh, it's POTS is nothing. Well, I'm experiencing it. It's obviously real if I'm experiencing it. And you said that's connected to histamines. Can you tell us, because I have two friends of mine that recently got diagnosed with POTS, and they contacted me, and I'm like, I don't know, I'm not your person. That's not me. I was like, but we can find somebody. It sounds like if they listen to this podcast, reach out to y'all. Tell us what POTS is. Give us the skinny on POTS.
Mm-hmm. So POTS is called, it stands for, it's POTS. It stands for Postural Orthostatic Tachycardia Syndrome. And just like other syndromes, one very commonly known one is IBS, irritable bowel syndrome, symptoms can come and go. So there are things that we can do to improve symptoms, and there's things that can trigger symptom flares, we call them, so little bouts of symptoms. So also knowing that if it is something that you were diagnosed with, you're not stuck forever. There are so many things we can do to help reduce symptoms. POTS is a dysfunction of the autonomic nervous system. So we could think about that as the involuntary nervous system. It handles heart rate, breathing, blood pressure, all of that stuff. In POTS, there's an excessive increase in heart rate upon standing due to impaired circulation in the body. So people without POTS, you're sitting down, you stand up, the body detects a quick drop in blood pressure, and everything kind of uh, everything kind of compensates in a very normal way to where you don't really have any symptoms. You just go from sitting to standing, no problem. In someone with POTS, there is an excess of vasodilation. So the blood vessels stay open a little bit too long. And so blood is pooling down in the feet because of gravity. So as we know, there's two ways to increase blood flow throughout the body. One is heart rate and one is blood pressure. So if blood pressure drops, the response is to shoot heart rate up super quickly. So if someone's ever stood up too quickly and noticed that they get dizzy or the room starts spinning or they kind of black out a little bit or they feel palpitations, fast heart rate, this can also happen in a really hot shower. If someone gets dizzy and having heart palpitations in a hot shower and heat, that can also be from POTS. So it's basically this inability of the body to compensate for a drop in blood pressure, and it shoots the heart rate up super high, which can cause some kind of scary symptoms for a lot of people.
When somebody gets diagnosed with POTS, what are certain things they probably get misdiagnosed with prior? Because I feel like someone would come to POTS, obviously they're like, hey, heart rate issues, other issues. The people that I know went through a series of almost like, I don't know if someone call it misdiagnosis, but because it's like they went through the process, right? What are certain things that people get misdiagnosed with?
You know what a big one is? Anxiety. I see this a lot with women and men also, but if you think about it as, when we think about anxiety, we think that I'm thinking about something that freaks me out and my heart rate goes up, I have a stress response, my blood pressure goes up, my heart rate goes up. Now, that is coming from the brain, coming from thoughts. What happens with POTS is it's the same anxiety response, but people are like, I didn't have any anxious thought. Like, I'm not anxious. I don't know why all of a sudden my body is having this reaction. So they go to the doctor and they might notice that they're, having these heart rate fluctuations. And a lot of the time I see clients that went to the doctor and they're just like, you have anxiety. This is all in your head. You kind of have to, just calm down a little bit,
Yeah. What a horrible thing to hear for some people too, right? Like, it's just anxiety.
Which honestly, and because this is it's regulated by the nervous system, it can work bidirectionally. So when we are having these very real physical symptoms, it can cause a mental anxiety response because it's really scary. And so that anxiety response then feeds back and can worsen the physical symptoms. So inherently, being misdiagnosed or being told it's just anxiety or being invalidated can actually end up worsening the symptom and making you have either a bigger flare or a flare that lasts longer because you're having this stress response associated with it.
When you say a bigger flare or a longer flare, people who are experiencing POTS symptoms, is there a typical time period? Like, is it like, hey, they usually last 1 to 3 days? Is it the day? Can people be in POTS-like symptoms for months?
So I actually recently just had a client who had a flare that lasted like a week and a half. And so what we noticed as we dove deeper, and this is the work that the kind of like that mindset work that I do with clients, that we all do with clients too in the practice, is when she is able to, when we work on kind of calming down that threat response, we do that with knowledge, just kind of being aware of what my body's doing and why it's doing it. And then also reminding our body that it's safe. We can do that through words and we can do that with physical strategies. When we do that, we see that the flares last shorter. So we might notice that it might just be, it could be a quick little flare. You stand up, you get a little bit dizzy. You might sit down, put your legs up the wall, drink some extra salt water, whatever strategies you're using, and then you feel better and you're good. But what we notice too is that sometimes these flares are lasting so long and it's this feedback loop that keeps happening. So there might be low blood pressure for a variety of reasons. It could be dehydration. It could be induced by alcohol. It could be a viral infection or a gut issue. Psychological stress
Mm.
can do it. And so, or a combination, a lot of the time it's kind of a lot of these things together. And when we're experiencing that, it's really scary. And so the body all of a sudden is feeling like, I'm not safe. There's a threat. We have to do something about this threat. That increases the stress response, more adrenaline,
Mm.
increased heart rate more,
Mm.
increased palpitations. And then we notice that we start to get all of these symptoms for days at a time. And so that nervous system support is part of the, I don't want to say treatment, part of the management of this condition.
This, I know it's not the same. This almost feels like a vertigo type response. Would that be?
So,
Because I remember I had an inner ear infection one time, and I stood up, and I like, I literally like thought I had a stroke. I'm like, I'm in the middle of a stroke, right? Like I'm on my way down, but I had the dizziness, the couldn't see. Is it a vertigo type feel? Can people have a vertigo type feel to that?
so I it can be both. So there's
Okay,
people that have a little bit of a vertigo type of manifestation. There's some
yeah,
people that feel like there's kind of like this buzziness, like this buzzing sensation, like a physical body anxiety.
okay.
And when it comes down to it, a lot of this is related to the blood flow piece of things. But what's interesting is that we've seen an increase, and we were talking about it before, we've seen an increase in these POTS symptoms post viral infections, COVID being one of them.
Okay, yeah.
Interestingly, at the same time, these symptoms can be exacerbated by physical or emotional trauma. So, what happened
Oh,
around that
okay.
time in the pandemic? It was a really scary time for a lot of people.
Isolation. We're
Yeah.
isolated.
Mhm.
We're scrolling the news. We're in our houses all day long. The world's coming to an end. Everybody's got COVID. There's
Yeah.
riots outside, and we do nothing but watch the news.
hmm So now we have, let's say there's someone, and a lot of our clients had this happen where, let's say there's a viral infection that's causing this physical reaction, and then there's this psychological and physical trauma that's going on. And now we see an increase in not only POTS, but also something called histamine intolerance or mast cell activation syndrome, or MCAS, if you've ever heard of that as
Yes,
well.
yes. Hmm.
And that's when the mast cells in the body release either too much histamine or they're too quick to release histamine. We call it like an allergy to stress, basically.
Okay.
So it's kind of this response that happens to a perceived threat, whether that's physical or psychological. And what's really interesting is that histamine, which is released by mast cells, is a vasodilator. So it can dilate or open up the blood vessels, drop the blood pressure even further, and then also lead to these POTS symptoms. So they kind of work bidirectionally as well, because if we have a psychological stress response to our symptoms, then we also see an increase in more histamine release because the body thinks that its own symptoms are a threat that it has to fight. So as you can see, there's this very, very real physical, biological response that's happening. But there's a connection with the way that we're viewing that response, and the way that we're responding to our symptoms can actually kind of work in this feedback loop with each other.
Mm. So I hear you say this, and I think, well, one, I think, is this curable? Like, can somebody like can somebody go get diagnosed with POTS and get the symptoms under control from, however, I don't know if it's lifestyle, diet, nutrition, a combination of the few. I don't know if medication is involved. Are there people that can be diagnosed, have an issue, and then go years without having a flare up?
So when we find that when we do two things, when we work on reducing triggers, so for example, someone with POTS might really not want to stand in like a super hot shower for a long period of time. Um, when we reduce actual triggers that can cause these symptoms, but at the same time improve our management of these symptoms and also our psychological response to these symptoms, we can certainly be symptom free. So, and we might see flares pop up here and there, but they become so normal and we become so good at managing them that
Okay.
someone with POTS might feel like, ooh, I feel like my blood pressure's a little low. I'm just going to add some extra electrolytes to my water, or I need some extra salt today. it
Mhm.
becomes this subconscious thought, and then they kind of go about their business, and it becomes this very the management kind of integrates
Yeah.
into your life, basically.
I hear you.
Same thing
Just like,
with
yeah.
go ahead.
No, yeah, you learn that it's just part of what you got, and I learn to manage it over time, and I don't get freaked out by it, right? Which, like you said, causes that loop back and forth, is teaching people to manage it, right? So the loop, I can see the anxiety side of it too, right?
Mhm.
Where you don't know what's going, and all of a sudden you got this feedback going back and forth. They're just bouncing off each other. You don't know what it is. You don't know how you feel this way. You get anxiety about it. You get on Google, right? You get on Google,
And now
and
on
all of a sudden you're having a
ChatGPT.
heart attack. Yeah.
Okay.
Now you're Chat GPT in it. Before you know it, you're calling a cardiovascular doctor because you think you just had a heart attack today.
Yeah.
Right. Right. It's like when I told you when I had vertigo, I was like, I'm having a stroke. This is how it all ends up right here. Here it goes, man. Um, when
And I
you, no, please continue.
and I totally I understand both sides of it. Like, I've been there. You're in a really, really scary situation. Maybe you've never had these symptoms before, and now you're having extreme POT symptoms that you're having a rapid heart rate, palpitations. Maybe you're having these adrenaline surges or this intolerance to heat or exercise that you've never had before, or your body feels shaky. Or in the case of histamine intolerance or MCAS, maybe you're having this facial flushing, hives, skin reactions. We have mast cells
Uh,
all over our body, so these symptoms can pop up in many different areas. We can have diarrhea, GI issues, brain fog, vertigo, headaches, migraines. And when these things are happening, and then you go to the doctor, and the way that our current healthcare system works is that I have heart palpitations, I'm going to go to the cardiologist, or I'm having hives, I'm going to go to the dermatologist. When in reality, all of these symptoms are kind of coming from a similar root cause. So when we go to these doctors, sometimes you're not getting answers. Sometimes your labs look totally fine and everyone's telling you you're okay. You feel invalidated and like, am I going crazy? What's wrong with me? And then the only thing that we can turn to is the internet or ChatGPT. And at the same time, what's happening is that our body is not feeling safe. It feels like there's a threat that it has to mount an attack on, and it has to neutralize this threat, basically. And you might find, and I'll talk to clients about this too, notice how your body feels the longer you stay on ChatGPT or the longer you stay on Google. Are you finding answers and it's making your nervous system calm down, your body relaxes, and you're less tense and you feel safe? Or are you finding that all of a sudden you're getting tunnel vision, your heart rate's speeding up, you feel like your body's tensing up? That is a sign from your body that it's going deeper into this threat response and this fear. So we can certainly search for answers, but the number one thing we have to do first is introduce safety to the body. So, and that's really, really hard to do if we don't have the information, which is why it's so important that we're talking about it today.
I feel too, we talk about this all the time, that, our current medical system, they really love to look at your labs and say nothing's wrong, but nobody wants to treat. We always say you got holistically treating the body from looking at labs, because we will do some lab work for people, because let's face it, your doctor will give you labs and then schedule an appointment a month down the line. And while you're looking at these labs, you
Like,
don't know
what
what
is
they
going
say, what they
on?
mean. They don't,
Mhm.
yeah, what is going on. And we will help people with basic things, but people treat the blood work. Nobody ever treats the symptoms anymore, right? They want to look at the blood work and they go, well, you're fine. It's no big deal. Well, that's weird, doc, because I stood up yesterday 3 times and almost passed out,
Mhm.
but I'm glad to know I'm fine. Right. Um, Sounds like some blood sugar things in there too. It has a blood sugar type symptoms.
So what's interesting about this is that a lot of times, and I know I have POTS, and I know that when I first had it and I had the symptoms and didn't know what was going on, I would often eat something because a lot of those symptoms are similar to low blood sugar. So I
Uh-huh.
would think, oh my God, I feel like I'm going to pass out. I need to eat something with sugar in it. And
Mhm.
then and it wasn't getting better. It wasn't helping. And it's really confusing because they have similar symptoms. But
Yeah.
what you can also do is, let's say, if for example, if you go to the doctor and you have chronically low blood pressure, which sometimes they will tell you, oh, you're so healthy, your blood pressure is so low. I was going into the doctor, my blood pressure is like 92/60, and everyone's like, "Oh, you're so healthy." Meanwhile, I can't even stand up off the table because I feel like I'm
Yeah.
gonna pass out.
Yeah.
So, at that point, then once I learned about all of this, people with POTS might need up to 5 to 10 grams of salt a day.
Oh my
That's a lot of
gosh.
salt. And
Yeah.
that what that does is salt increases your blood volume. And so I know for me personally and for a lot of my clients, just the simple act of adding salty, like extra salty electrolytes or salt to your water can bump up the volume of your blood, increase your blood pressure, and then help with blood flow. So that one thing alone can be helpful. But at the same time, if it is a blood sugar issue, then of course it would be more related to food and you would need to eat something that had carb or sugar in it. What's interesting is that low blood sugar and high blood sugar, but low blood sugar can also trigger histamine flares, which
Oh,
then releases so your mast cells release histamine because the low blood sugar is a threat response in the body. But then what happens with that? Your blood vessels dilate and you can have a drop in blood pressure. So the
Mhm.
low blood sugar might be a cause itself of the POTS flare or the low blood flow. So that's where kind of learning what these symptoms feel like and knowing kind of what's a quick way I can respond and see, what each one feels like in my body and what each response feels like in my body, you might start to learn the different strategies that are helpful for you at different times. Now, obviously, if you work with a practitioner who works with these conditions, they can help you do that closely, but also, what's the downside of adding a little extra salt and seeing what happens? Or same thing with even just laying on the floor with your legs up the wall increases blood flow to your brain. So if that is helping you, it's probably a blood flow issue. And so sometimes I'll have people just see like, what does it feel like if you lay on the floor? Does it get better?
yeah. Yeah. Do you guys work closely with mental health professionals? Do you guys have a mental health professional connection?
So I always encourage clients, especially if these symptoms are chronic and it's causing a lot of psychological stress on your life. I always will encourage clients to work with alongside a therapist so that we are working together. I'm a dietitian; they'll work with their therapist. Very often, I talk to clients because the nervous system is it's a biological thing that's happening in the physical body. So I will work with my clients on some nervous system strategies, some vagus nerve techniques when it comes to the physical body, when it comes to thoughts and the psychology of it. That's when I also want them to work with a therapist. We do some somatic work. So, how do we show the body that it is safe from a very physical standpoint? And that could be something like humming can soothe the vagus nerve and calm the body. Diaphragmatic breathing really deep into your low belly, longer exhale than inhale. We might do, something even just like sounds so trivial, but joy. Literally
Yeah.
just having a laugh or
Yeah.
enjoying something, which feels so hard when you're dealing with new symptoms or chronic symptoms. It feels kind of impossible. But the underlying piece of healing with any chronic symptom really, but especially these, is you have to believe that you can get better. And that's the hardest part, but it is very, very, very difficult to heal from any of these things when we feel hopeless, when we feel like we're not gonna get better. And so we have to kind of have this, like, very radical, hope in our body, and the way that we can do that is by, again, being informed, telling your body that it's safe, implementing some of these strategies to help support, and we can dive deeper into those. But we really also need to believe that the body's capable of healing because it totally is. We can definitely heal from these things.
Because of the kind of work you guys do you most frequently see people further down the line of asking questions? Meaning, like, they'll go through all their doctors, they'll get all the recommendations, they'll get all the blood work, they'll see multiple doctors, and then you guys are like, "I've been dealing with this for 6 months to a year. I'm just trying something different." Then they come to your I feel like you guys are probably our industry together.
Hmm.
Anything that manages lifestyle and wellness, they're usually the last people you talk to,
Totally.
right?
100%.
So you're probably seeing people that will come to you and say, "Hey, You're my last hope. Doctor said I'm fine. I don't have anything. It's all in my head. And I'm just rolling the dice on this. You
Mhm.
probably see a lot of that, don't you? That's people last. Yeah.
A lot. So we joke that people come to our practice when they didn't get answers anywhere else. And
Mhm.
when it comes down to it, it's never we never have symptoms. Well, we often have symptoms because of a variety of things, and it also takes a variety of things to improve symptoms. So we aren't always looking only at the food. We're not always looking only at the nervous system. We're looking at all of these things together. When I'm working with a client, we're talking about, like, what does your life look like? What does your job look like? What types
Mm.
of things are,
Yes.
what patterns do you notice with your symptoms? And if they don't notice patterns, as the practitioner, sometimes we notice patterns. But yes, it happens all the time, because I think that from an overall holistic wellness perspective, we're looking at the physical body, we're looking at the spirit, the nervous system, the life, everything, relationships in your life, all of those things
Mm.
are feeding into each other and creating this image of what your health looks like. And oftentimes when we go to certain other practitioners, and there are phenomenal practitioners out there and not
Yeah.
phenomenal practitioners out there,
Yeah.
but sometimes when we go to ones that aren't so helpful, they're kind of isolating it to either exactly one part of the body or exactly one fix, or there's no medication for this, so I don't know what to do. You're just going to have to deal with it. And at the same time, what I notice in a lot of clients is just the act of feeling seen by your
Mm.
practitioner can literally improve your symptoms. I have had
Mhm.
clients, we didn't even do anything yet. We had our initial session, and just listening to someone's experience can be cathartic for them. And as
Oh.
we know, stress impacts all of these symptoms. All of these conditions are regulated by the nervous system. So if you go to a doctor and you feel like they're not listening to you, you feel like they're gaslighting you, these symptoms are actually physically going to get worse. And so when you also see someone, whether it's a practitioner or someone close to you in your life that listens and understands, or maybe doesn't understand, but still wants to get to the bottom of it with you and supports you, that can literally be healing in itself.
Mhm.
We had a friend of ours as a physician's assistant, and we were talking, and he totally took me shocked that we went down this route. I go, "What are other things that you do?" And he goes, "Well, sometimes I'll sit down with some people and somebody and say, 'Do you like your job?
Mhm.
Do you feel like you're adding value to the world? Like, do you have purpose and meaning outside of getting up at 7, going to work at 8, coming home at 5, cooking dinner, sitting on the couch, scrolling social media, watching TV, and doing it again? Like, do you think anything you do actually, like, is adding value? Do you like it what you do?'" And a lot of the people that he struggles with, especially like the autoimmune side, will say, "I could disappear and they'll just replace me." And I'm like, "Damn, like, it's brutal to think about." It sounds like you're talking
Mhm.
about the same things with people.
100%. And it works bidirectionally, because these symptoms can deplete you. They can be very, tiring, physically and mentally. And it can sometimes feel like it takes the joy out of your life when you're just literally trying to figure out, how do I get through the day when the second I step out of bed, I'm having heart palpitations. I feel dizzy. I feel like I can't, get my kids ready for the day. And when I'm in a long car ride on my way to work, I start getting symptoms because of the vibration in the car. And all of these symptoms are happening, and there's this fear, but you also have to take care of your family and your job. And even if you had a job that you loved, it can kind of suck the joy out of it a little bit. But on the flip side, if you feel, overworked, overstressed, no purpose. As human beings, we want to feel like we have a purpose and we're making a difference in the world, um, or even in our own little world. And so, in that situation too, it can feel, again, there's no joy. There's no joy is literally anti-inflammatory. It can literally cool down inflammation in the body, change how the body is physically showing up symptom wise. And so part of the pillars, when I think about like the foundations of health, we're looking at sleep, recovery, stress support, stress management, stress resilience, whatever you want to call it, hydration, movement, nutrition. We're looking at all of those things, but we're also looking at how do you feel about your life? Like, what are your
Mhm.
routines? Um, you know, or do you feel either positive or neutral about things when they pop up? Are there things that you're looking forward to that you're excited about?
Yeah.
And again, part of our job too is if someone's experiencing symptoms or going through a hard time with, their body, it's also about encouraging them and helping them find joy in the smallest little things. Sometimes I'll ask a client, think about the last time you smiled or you laughed for like a half a second. You like scrolled through a video or you heard a song come on in the car that you last heard when you were like 15 and you love that song. Make a list of those things that bring you joy. And we want to come back to those because sometimes we need to start very, very, very small when we're trying to manage all of these symptoms. And then we can start to get back into maybe I'm socializing more. Maybe I'm now spending more time with other people. But overstimulation can also, you know, feed back on some of these symptoms and make people feel worse. So sometimes we start very, very small with the small components of joy. And then we can work back into building out your life again.
It's so interesting to me
That's so
how,
powerful.
yeah, just how connected our body is to everything that we feel, you know? I think it's incredible. And
Yeah.
I know you mentioned earlier that you were a personal trainer as well. How would somebody go about exercise in a safe way when they are experiencing POTS or something, or even low blood sugar? Because we know stress on the body is very much related to it.
Yeah. So this is really interesting and it's kind of jarring for someone that used to train or used to love exercise or exercise a lot and then they, maybe got COVID or a viral infection and then started getting symptoms of histamine intolerance and or POTS. And now they start to exercise and they're having this excessive increase in heart rate. They're having palpitations, they're having lightheadedness, and they're like, am I just deconditioned or this is scary. Like, why did something I used to love now I hate it or I feel really uncomfortable doing it and it feels scary. So what we want to do is also we want to find the sweet spot because being completely sedentary can also make these symptoms worse. If we think about what supports blood pressure is blood flow. What helps with blood flow is the squeeze, kind of like having muscle on your body, movement. But high intensity movement can also worsen these symptoms and increase the stress on the body too much. So, if we're thinking about, okay, what do we do in these situations? First, we want to manage these symptoms outside of the workout and make sure we optimize that first. So, when we're doing that, maybe we're using some supportive strategies like upping electrolytes and salt in your water. Maybe we're doing calf raises when you wake up, putting on some compression socks to it's like squeegeeing your calves to shoot blood back up to your brain. Maybe we're doing legs up the wall, laying on the ground with your legs up the wall, diaphragmatic breathing. Cold can also constrict the blood vessels and help support those symptoms. So let's say a cold shower, ice pack, um, you know, again, those positive and neutral thoughts as much as possible. But now so outside the workout, we also need to support all this stuff. Electrolytes are going to be like your best friend. So that's something that we definitely want to go hard on, like before, during, and after exercise. And we want to start very small. So when it comes to, like I said, muscle mass helps with that pump, with that blood pressure. So we want to have strength, we want to have muscle, but oftentimes people have been experiencing these symptoms for a long time and they can't exercise, so they've lost some muscle, or they're
Hmm.
scared to exercise, so they don't. So what we do is there are certain protocols, like the Chap-Levine protocol is one of them, where they're kind of more structured programs to help someone with POTS get back into exercise. The whole premise is starting recumbent or starting laying down. So, for example, if you're thinking about something like lying leg raises or lying glute bridges on the floor, you're increasing blood flow to your head because you're laying down. And we can work on glute strength, hip flexor strength, core strength while you're laying down. So we're not having as much of a drop in blood flow to the brain. Once we start to slowly increase strength there, then we can do some seated exercises. Then we might work our way to standing exercises. But the key here is give yourself grace, be patient with yourself. I have some clients where symptoms are so intense in the beginning that we literally start with one set of glute bridges a day in the morning, and then we work our way up to 2, 3. There's no place too small to start. We don't want to exacerbate your symptoms, but all of my clients kind of get to a point where they're like, okay, I'm ready to add more. And then we just continue to add more. And knowing at the same time when we learn how to manage our flares. So when we're like, oh, okay, I'm getting these palpitations, my heart rate is increasing. Okay, I'll have clients just put your hand on your chest. I'm safe. Nothing's wrong with me. I'm having low blood pressure. That's all that's going on. We lay on the floor. When you know that you can manage these symptoms, they get less scary because your body
Gotcha.
knows that it can trust you to manage that. And then even if, let's say, we do have a workout where we go a little too hard or we do a little too much, we manage those symptoms. We learn that we have to back off a little bit, and then it doesn't feel like it lasts the whole day because that fear response is lower.
I want to touch, and again, as I sit here and we have this conversation, we're probably going to like dominate more of your time and maybe ask for a part two.
Yeah.
Because
I love a part 2.
yeah, because I'm kind of like, I do want to touch on the next subject, but I feel like I want to do it like the right way.
Mm-hmm.
You mentioned that you deal with a lot of disordered eating.
Mm-hmm.
Binge eating was the one you talked about. Any kind of I feel like disordered eating is like this broad,
Yeah.
huge, right? Like you could fill a room with disordered eating. People have disordered eatings, and you could have 15 different people in there that have a different level of disordered eating. We've talked about this before. I previously had I was a food punisher. I would eat like something I didn't want to eat, and I'd be like, well, tomorrow I'm going to completely destroy my body. I'm going to carb deplete. I'm going to do 2 cardios. I'm going to lift really hard because I ate pizza.
Mm-hmm.
I started tracking my food, and what happened to me years ago to start tracking my food, I go, that one piece of pizza didn't do anything. Like, give me a break. Like, I can eat 3,500 calories a day. Like, that's a lot of food. And tracking was freedom for me,
Yeah.
right? It was freedom. I know some people, that's not a good idea for them. Tracking food is not good. They'll restrict and go in the other direction. But for me, I started tracking food and went like, I opened up my variety of food because I realized a piece of pizza, give me a break. I was punishing myself over that. That's stupid. To where like I went years without drinking milk, years without even having a bite of ice cream. I remember I couldn't tell you the last time I had like a piece of chocolate, like years, because I was like, those are bad foods. I only eat good foods. And when I do eat bad foods, I have to burn it all off and kill myself tomorrow. Right. Luckily I got out of that. And I guess I say that because like some people wouldn't think that food punishment is disordered eating. Like that's unhealthy. The binge eating side of this. Well, first, tell us how you got into that side,
Yeah.
and then we'll
So
talk a little bit about it.
when I was much younger, I was more of a restrictive eater. So it was kind of my way. I was bullied a lot in school, and it kind of felt like this way that I could have control. I could control the food when I couldn't control what was going on outside of the food. And at the same time, I was, bullied for other things that were, let's say, like body related, but it wasn't my weight. And so I was like, okay, at least I can control the food so I won't be bullied for my weight. And then eventually you can only do that for so long. So that kind of turned into more of a bulimia, which is binging and compensation, whether that be purging or over exercise. And then eventually that got to a point where I was like, I can't keep this up any longer. And then that turned into just binge eating without compensation. So just binge eating itself. And I found that at the time, and this is so common with eating disorders, that there's this concept of feeling like you're not sick enough to get help, or to get treatment. And from an insurance standpoint, it kind of works that way a little bit as well. I remember being on Google and seeing, oh, okay, I at the time was binging and purging, and I was like, okay, wait, hold on, I only do this once a week, but I have to do it twice a week or 3 times a week for it to be an actual problem. So maybe I don't have a problem. When
Mm,
the way that I look at it with my clients is, do you feel like you're not in control around food? Because at the end of the
Mhm.
day, that's really all that matters. If you eat one cookie and you don't feel like you're in control, let's work on that. If you eat 2 boxes of cookies and you feel like you're not in control, let's also work on that. We're
okay.
working on them both in a very similar fashion because of your personal experience with it versus the amount of food that's on your plate. And so at the time, I just felt very lost. There was a lot of shame around it.
Mm,
I didn't know anyone who was dealing with that or who was binge eating. I didn't even know that was a thing.
right.
It feels very isolating. And then what happens is the shame and the guilt increase distress in the body. And what do we do when we feel distressed? We want to search for something to soothe. So, inherently, having more shame and guilt and secrecy around it actually leads to more binge eating behaviors. And so, eventually, I went to nutrition school. I, got some support, whether it was therapy or nutrition support, and eventually was able to kind of heal myself through all of these different modalities. One of them being tracking my food was my personal experience. And then getting into strength training helped my confidence, and that helped with it as well. And then looking at food as fuel in strength training versus kind of the enemy. And then what I noticed was when I started working with clients, I never had someone by my side that I could confide in that was there to help me and support me and be on my team and not judge me while I was going through it. And I also got some treatment along the way it felt damaging. It was almost like traditional treatment that actually didn't help me at all and made me feel
Mm,
worse.
mm.
So, what I love is kind of working with someone who, we feel like there's no hope. We feel like we can't get better. We feel like this is always going to be how it is or that there's something wrong with us. And when we start to, when I'm working with a client who is able to finally realize, like, oh, I can shift my relationship with food. And my favorite part about that is our relationship with food very often mimics our relationship with our life, the people in our lives, the people around us. And so when our relationship with food improves, those things improve too. So that's kind of the best part of all of it is that, I'll have clients who feel like their relationships get better. They feel like they can be more social. And it's not even about the weight at that point. It's about or the binge eating. It's really about like, how do I get my life back? How do I feel like I can be me again or find me for the first time?
Here we
I
are
love
back to
what
the
you
holistic kit.
Yeah, and I love what you said about the strength training piece of it too, because I think that's what we teach a lot of the time is or I encourage it a lot with female clients is, like, strength training was my greatest teacher, and I wasn't somebody that always struggled with food, but strength training made me a more confident person, it made me a more decisive person, like, whether that's your relationship with food or your relationship with your sleep or strength training, whatever it may be, like there is such a connection to everything else around you when you have put yourself first in some way.
What you said something very I always it happens every episode. Somebody says something very quick in passing and I catch it and I'm like, "Wait, no, that's big." Um, I'm not sick enough to get help.
Mhm.
How many girls out there, and I say girls just because predominantly girls have like eating disorders is obviously more of a female thing.
It's
I know
more
they're men.
yeah,
Yeah, more prevalent.
yeah.
How many girls are out there on TikTok? They're anorexic, but they see the girl who's way more skinnier and way more in trouble than they are and go, "Well, I'm not like that girl yet. I'm not like that TikTok girl who's" there's a really popular video out right now that a girl looked really bad, like the bad anorexia, like the one where you're just like, "Oh, I hope she has friends because she looks really bad." And she tracked her journey back and how she started eating healthy and lifting, and now she's doing like pull-ups and cool things. And there's a video out, but like there's probably a ton of people out there that see somebody else and say, "Well, I'm not that bad, so I really don't need help because I don't look like
Mhm.
that." That was very interesting. You said that, and I'm like, "Oh, whoa." There's probably a lot of people out there. Well, I'm not
Mhm.
that bad yet,
Mhm.
Mhm.
right?
It can show up in many different ways too. Like when I think about something like a restrictive eating disorder like anorexia, there's something that is there's certain in the DSM and there's certain diagnoses that we now recognize that you can have anorexia and be in a body size that's not an underweight BMI.
Okay.
And you can also be underweight and have anorexia. And so we're starting to like widen the scope of all of these eating disorders, but it's with restrictive eating disorders or someone who has, an underweight body composition. We also live in a society where that's commended. And
Oh,
oftentimes people
yeah.
get when someone is losing, I oftentimes, even someone who's losing weight in a healthy way, I often find that there's this jarring experience that happens where you start getting these compliments. And whether it's an eating disorder or you're intentionally losing weight in a healthy way, all of these people are now commenting on, "Oh, you look great." And the
Uh,
first thing that I know for me and a lot of my clients, the first thing the brain goes to is, "Wait, what did you think before? You've been looking at my
Mhm.
body this whole time?" Like, and there's this feeling of now you're comparing yourself to where you were prior, but not in terms of the mental improvement that you've gained, but you're comparing yourself physically to where you were before. Now you're comparing yourself more to those around you, and it can actually be sometimes a hard, damaging experience for people. And from the anorexia nervosa side of things, I have a lot of clients who they didn't even know that they had a problem because their family, friends, strangers are telling them that they look great. And so there's this feeling of, oh, well, I don't have a problem. And now I'm also actually scared to eat more because I keep getting compliments. So are people going to
Mhm.
notice that I gain weight? Are they going to think something bad of me because of that? And then on the middle ground, my personal experience was that I had bulimia and no one knew. I was, going to work, doing my life, like doing everything that I normally was doing. No one had any idea. But my body size was a normal BMI or something that was more traditionally normal. And so no one thought I had a problem because I wasn't too thin and I wasn't overweight. And so I must be fine. And then on the other side of things, when people are in a larger body, there's a stigma around it too, because, there's sometimes an experience of, I feel like I know people are looking at me regardless. And that increases fear and shame without even someone saying anything, which can then lead to more binging. And that can feel really distressing for people because it feels really confusing. This happens a lot it starts in childhood where, maybe you're being bullied because you're in a larger body. And then you go home and are binge eating. And it's very confusing because in your brain, you're like, why am I self sabotaging in this way? Like I'm being made fun of or being looked at or insecure because I'm in a larger body, but now my response to that is eating more. Why am I doing that? But if we look at the binge eating as a symptom, I don't really look at it as its own. I mean, it is a behavior, but I look at it as a symptom of a greater issue. There's a root cause to it. So it usually is a symptom of the body not feeling safe. So either we're feeling physically unsafe, our body is having low blood sugar, or we're restricting our eating, or we're having chronic symptoms like POTS or, histamine symptoms, or chronic pain, or we're having shame or guilt. All of these different things can cause our body to reach for soothing and comfort in the quickest way that it knows how. And from a very young age, food has always been accessible for most of us. So at a very young age, we learn food makes me feel better. When I don't feel good, food makes me feel good, at least
Mhm.
temporarily. And so it actually does make sense that if you're being bullied or you're feeling ashamed of being in a certain body size or looking or feeling a certain way, and then you're reaching for food, your body's literally just trying to protect you. It's just trying to soothe in the way that it knows how. And what we have to do at that point is teach the body that there are other ways to soothe, sometimes at the same time as using food, and then we transition off of that. But there are other ways that our body can feel safe in addition to food. And once it gains that trust, again, that self trust with your body, then food doesn't become as scary anymore because you have all these other tools in your toolbox.
When
sounds like the
you're
slippery slope of people call stress. I'm sorry, Greg.
Mhm.
Go ahead.
No, you're fine.
Good.
I think my audio is a little behind too, just because I'm on my phone.
Are you?
Um, yes, because my hotspot went out. I am like relating to this a little bit. I started working with a younger client a couple of months ago, and I mainly just train her, but I do speak with her a little bit about, nutrition and stress and things like that. What are the kind of behaviors that you partner with food? Because you said that, sometimes you might work with food kind of to get it out of feeling safe. What are the other behaviors that you might partner with that? Or what are the actions, maybe the questions that you ask your clients, or um, maybe even like the reassuring pieces that you tell them so that they can feel safe?
Yeah. So the first thing I always start with is, and I touched on it a little bit before, but it's the most important thing, is knowing that this is literally a protective mechanism in your body. You're not
Mhm.
self-sabotaging. There's nothing wrong with you. Your body is not working against you. It's We are biologically wired for survival. And when you're feeling like anxiety is very high, stress is very high, um, your body is looking for a way to get out of the discomfort. And so it's actually having the primary intention is to help you. So first we have to kind of, I mean, literally like thank your body for trying to help this whole time in the way that it knew how. We always are doing the best with the information that we currently have. And so then we introduce new information. So we might notice, I think about the causes of binging as two different things. So the first one is the food. I don't find that it's the most common, but it definitely is one. So I want to make sure that, are we eating at regular meal times and having stable blood sugar? Are we having enough protein and fiber in those meals? And so that might look like, breakfast within an hour of waking, eating something every 3 to 4 hours after the last meal event, and then looking at the composition of those meals. Now, the second piece is, are we what are we doing about the discomfort? So when are we noticing this discomfort pop up? Are there patterns that we can see? Is it a transition event that's happening when you come home from work and you can breathe for the first time all day and that's when you're binging? Or is it showing up mostly when you're around a certain group of people or a certain person, or when you're thinking about something, or when stress is high, in certain environments? So we might notice, without any judgment, when do I notice this popping up, and what are the thoughts in my head that occur at the same time as these things are happening? And then what my favorite thing to do is introduce what I call like introducing a pause. So oftentimes we feel discomfort, and it happens all within like a millisecond. We feel discomfort, our body knows food's going to help this, and we reach for the food. And it's all just happening at what it feels like simultaneously. The first thing that we can do is implement even the smallest pause. It could be a minute, 5 minutes, 10 minutes between having the desire for the food and actually reaching for the food. When we have a little bit of a pause between the two and we're left with whatever emotion or thought or discomfort is popping up at that moment, then we can start to explore it. And that can feel really scary for people. So we start as with as little time as you want. But once you can sit with that discomfort or learn about it or get curious about where this is coming from for just 1 minute, your body starts to learn, oh, we can do this. This actually isn't as scary as I thought it was. And then the 1 minute turns into 5, turns into 10. Within that minute, though, sometimes we're doing other nervous system supportive strategies. So maybe we are, doing something like going outside for a walk in the sunlight or in nature, or just physically shaking out your body, putting on a song and dancing to it, doing some deep breathing, calling someone that you love or that you feel supports you. It could be legs up the wall, like a POTS technique, but that also is helpful for calming down the nervous system. Singing and humming stimulates the vagus nerve, cools down the nervous system. We don't have to do it for an hour. We just have to slowly realize, like, ooh, did this even subtly improve my stress response? And then it's still a win if you reach for food after that pause. Because what
Mhm.
happens is, even if you eat, you didn't just reach for the food. You now did something, sat with it for a minute, and then reached for the food. And then over time, we might need less food because we're a little bit more regulated going into eating. So the food becomes a little bit less important over time. And then we might notice weeks, months down the line, maybe we're not reaching for food at all. Or maybe the binge turns from eating, a whole box of cookies to eating 1 or 2 or 3 cookies. And that's a huge win because progress comes in all shapes and sizes.
Man, that's incredible small little nuggets of behavior modification, right?
Mhm.
And they got to be really patient because, like, how common in our culture is it now for people just to be like, I'm a stress eater?
Mhm.
I hear that all the time. Everybody. I have a client right now that went back to school. And when she snacks, she has correlated that high amount of schoolwork, sitting around the house, high stress, bag of chips, smashes through food. And I'm like, well, where'd that come from? She's like, when I delay my schoolwork and then I got tons of schoolwork, I get really stressed and I just go through food. And the way she describes it is like, I don't even realize I'm really doing it.
Mhm.
I'm just that, right? And because stress eating is just one of those things in our society. I think everybody just goes, I'm a stress eater,
Mhm.
and then but that sounds like a slippery slope.
So what then this is a cultural thing I find oftentimes too. The slippery slope also starts with when we start over identifying with any type of identity. So if we're saying I am a stress eater, I'm plugging in my computer. I am a stress eater, or I am a binge eater, or um I am someone with this, what, insert condition here.
Yes,
We
Mhm.
yes,
start
yes.
to we convince ourselves that this is now our identity, this is now who we are, and inherently in having that identity, if I say I am a stress eater, I'm literally telling my brain, this is who we are now. We have to just deal with it. There's no hope here. So
Brutal.
Mhm.
if we just literally change that sentence and we can say, just call it an observation. I notice that I have been stress eating. Okay. So that doesn't mean I'm always going to do it. That doesn't mean that it's now who I am. It's just a pattern that I've noticed. And now I have control over it in a way that I can first increase awareness of it, that I'm doing it in the first place. I can reduce the shame around it. That's a huge one. So even if you are binging and the pausing is feeling like it's not working for you, sometimes we dissociate and we kind of just are eating mindlessly because that dissociation is a coping mechanism. So sometimes the easiest place to start is actually after the binge. So after the binge, kind of reminding our body, ooh, I ate a lot. I don't feel comfortable. These are all observations. There's no judgments here. All of these things objectively happened. We first put your hand on your chest, tell your body, okay, we're safe now. I understand why you did that. I think I was trying to protect myself from that stress. How do I feel right now? Is there something that sometimes once we feel regulated and we reduce the stigma around it, then we can start to explore after the fact, is there something that would have felt good for me in that moment? And then we can start to look toward the next time that we feel stressed. Maybe it means that I need to take more breaks when I'm studying for school
Mm-hmm,
if the
hmm.
stress is super high. Maybe I learn that I need to manage my time in a certain way so I don't feel like I'm always kind of cramming everything in at the deadline. Maybe I need to, not work super late in the evening, and maybe it's more helpful for me to get up earlier and go to bed by a certain time because that reduces my stress load. Or it's just even noticing that the urge to grab food is just a signal from the body that it needs something. So if you're doing late work or you feel really stressed with your schoolwork or job and you have that inkling to grab food, sometimes I find that it's helpful I will literally like talk to my body and be like, oh, okay, what do you need? I know I wanted that food. What do you need right now? And then we can bring in some type of strategy there. Or if you're still eating, you at least are increasing awareness of it so that it becomes less mindless. The first step is
That's
being
it,
aware.
right? Yes, aware. Yes, I've said that so many times. Being aware that you do that is the
Mhm.
first step. Man, what you just said is like, man, I feel like I was sitting in church. Like, I was like, oh my gosh,
I
right?
know.
We have a girl on our podcast lost 164 pounds, and it by far was the most impactful story I've ever heard. Because it's not just the process of losing 164. Like, we all know that, right? She started exercising, caloric deficit, ate her protein, did. But the way she described herself, she goes, Josh, I described myself as, I'm always going to be big boned.
Mm-hmm.
I'm always going to be the funny big girl.
Mm-hmm.
I'm just always going to be a big girl. The way she described herself, and then the one of the most impactful sentences I've heard in all of our podcasts, she goes, Josh, when I decided to lose weight, and she went on one of the early GLPs for 6 months and then lost another 100 pounds after she was on the GLP. So I was really proud of her to be like, all right, I'm going to use it, get off it, change my habits, lose another 100 pounds. She goes, Josh, my only joy in my life was food. I would get up in the morning and think about food. I'd get up at lunch, think about what I'm going to feed my kids. And then me and my husband talked all day about what we wanted to eat for dinner. She goes, when I started that I was going to go on this journey, I was afraid I wasn't going to have any more joy in my life because the only place I was finding joy was food. And that comment broke me. I remember hearing her say that, and like I got sick in my stomach to hear her, because I've known her since she was in her 20s. And I'm like, one, what an incredible thing to say on a podcast where a bunch of people might hear you say that. Incredibly vulnerable, but what amazing way to look and say, wow, this is where I'm at. I'm not the big bone girl. I don't have to be. Like, she had to overhaul her friends, her environment, the way she let people talk to her, who she said she was in the mirror, and all of that. And I'm like, man, that is a crack in your identity and a refixing it about hitting rock bottom. But that was one of those heartbreaking things I heard somebody say, hey, the only joy in my life is my food. And my heart broke. Like, my heart broke when somebody said that. And if I took away my joy for food, where would my joy be in my life? And I'm like, man, I almost was like, all right, we're done. We're done here. Like, let's move on to the next subject, right?
And
I do want
I
to
would
do a
say,
part
like,
two.
yeah,
Go ahead.
I was just gonna say, I would say that's so much more common than we think. Like, we see so many habits of people that do find their joy in food or that glass of wine when they get home from work at night. And all I hear, and I feel like we hear it every time we get on a podcast, is like so much of this is stress related and how you do manage your stress. And I think it's very encouraging to hear from you, Nikki, that some of it is just like take a deep breath. Like, literally just take a deep breath. I've started doing my own deep breathing like every single day, and it's changed my day entirely. So I think it's encouraging to hear that it doesn't have to be the super lengthy routine. Like, if you are finding that you live in a high stress lifestyle or high stress body, you can literally take a deep breath or take a pause. So I think that's really empowering.
Well, I think you just drove out some little bitty steps that somebody can hear in this podcast and be like, oh, I don't have to, like, just being aware. Just being aware is change, right? I know you got to go. I don't want to push you to your next client. I would like to do a 2.0.
Oh, yeah.
Yeah.
Like,
I
we'll
would
schedule
love to do
2.0
2.0. Oh, yeah.
because, like, I feel like we haven't touched. I always judge the success of a podcast not by how many people listen, but what impact I feel like it can have on others. Right? You could do a podcast that talks about nothing and everybody in the world watches, and you're like, I didn't do much. You can do a podcast like this that you think one person might hear and go, oh, there is hope for me. Like, I can get hope, right? Just being aware that I have a problem. Like, I don't need my identity to be, the skinny girl. Like, I don't, and you were like, you start getting positive reinforcements. Also, like, people with body dysmorphia. Like, you find dudes that start getting big and everybody's like, man, you're big. All of a sudden, you're big. Oh, you're big. I had one of the worst dad moments I ever had in my life. The worst dad moment I had. I was sitting next to my wife, and I pulled my shirt up in the mirror. At the time, my kid's 9 now. He was like 5. And I pulled up my shirt in the mirror, and I touched the bottom ab, and I feel like I'm losing my bottom abs. And I was like, ugh, I gotta, like, and I just said that like random. And my wife came to me and she goes, hey, this morning Asher pulled up his shirt in the mirror and asked me if he had abs and what he had to do to get abs. And dude, talk about like a punch. She goes, I think we need to change how we're talking about our bodies around our kid. And talk about like that sick gut feeling. So now we don't even have those conversations. I don't do those things, but I'm like, I just naturally did it. Looked down, felt like the abs were kind of disappearing, said a comment in front of my kid. My kid never said anything to me, and the next day he's like, "Mom, do I have abs like Daddy? Do I need to do things to get my abs?" And I'm like, "Oh my gosh, my kid's gonna have mental health issues the rest of his life." Like you know what I'm saying? Like, I was like,
Yeah.
we had a dad moment, but she was really cool. She's like, "Hey, let me tell you about something that happened yesterday. I think you need to stop what you're saying about
Mhm.
things like that, because like your kid's 5 and he's picking up that." And I'm like, "Oh man, I guess when my kid's like 25 years old and he's in therapy, we can go back to that 5-year-old moment, right? Like bad
Mhm.
dad moment." But
And
thank
how
you very
yeah,
go ahead.
I'm just gonna say, how amazing is it that she pointed that out to you because
Mhm.
we it struck you because it was your son.
Yes.
And
Mhm.
it doesn't strike us as hard when it's ourselves. So
Yeah.
even if we're
Oh
thinking about like
man.
you have kids, would I say this to them about them or in front of them? If I don't have kids, picture like a, a photo or a version of yourself when you were younger. Like, would I say that to him or her? And binge
Mhm.
eating
Oh.
happens a lot it happens in men and women, in a lot of like when we think about the bodybuilding community in terms of like, bulking and like trying to go from a bulk to a cut and then feeling like, oh my God, I feel like I've been binging and I lost control and now I don't know how to get control of it again. So there are all these different pieces of where it can show up. But one of the biggest things I think you said about that client of yours was that the key was that we often think that we are going to feel a certain way about ourselves when we reach a goal, but we will probably never get to that goal unless we feel that way about ourselves to begin with. And
Oof.
we changing our body composition, of course, these
Oof.
things can support how we feel about ourselves. Getting stronger can support how we feel about ourselves. But we have to start the work and learn to find joy in something small, love something small, or not even love ourselves, just be neutral, like not hate ourselves, not judge ourselves, just be kind of there about it. And that is crucial to it's crucial to changing in terms of body composition or healing an eating disorder, or also healing these chronic symptoms when we feel neutral about the symptom itself as well.
Well, let's end on that. Let's end on that, right? Like
Mhm.
hey, thank you for coming on. We'll
Of
definitely do a part
course.
2 and
Yes.
find time that we can do it. Because I knew like 20 minutes into this, I'm like, yeah, we're gonna have to do a part 2. Like, this ain't gonna be.
There is so
So
I love
hey,
that.
much.
Nikki, thank you for coming on.
Of
We
Thank
course.
appreciate
Thank you
it.
you.
so much
All
for
right,
having me.
all right, bye.